Hello and welcome to the Mark David LGBTQ Center at Community College of Philadelphia's LGBTQ discussion series. Every month this semester, we've had a different topic and a different discussion that we've done. And now that you're on our YouTube channel, if you'd like to go see previous episodes, you can click on our channel and see the recordings of those sessions as well. Today, we'll be talking about medical discrimination, and we have partnered with the standardized patient program at Perelman School of Medicine. And so today we will be joined by a few standardized patients from that program, as well as Janice, who's joining us from the program to talk about what the program is before we get started. So I'm going to bring out Janice to talk about the SP program. Hi, Janice.
Hi, thanks so much for having me. Good
Yeah, no
afternoon,
problem.
everyone. Yeah.
So why don't you tell us a little bit about what the SP program is and what an SP is?
Sure. So an SP is a standardized patient. And these are basically people that are trained to portray patients for teaching and testing purposes. It started out in the medical community, but it's since expanded. It really started in the 1960s. And we've had SPs at the Perelman School of Medicine at University of Pennsylvania since the late 90s. So really, we can use SPs for a variety of reasons. So we can have them in classrooms, in small group settings. We can have them in one-on-one encounters with a learner for exams and assessments. It really started out as medical students. This is somebody that you can practice taking a history from, doing a physical exam on, and then you can get feedback from that person who is not a trained professional as far as medical information, but they can give you information about what it felt to them interpersonally and your bedside manner. So really, since that point, we branched out to all levels of learners, so residents, fellows, attendings, other practitioners in the health system. So it's not just medical students anymore, but it's also people that are already working in the health system, nurses, frontline staff. And then we've since moved beyond healthcare. So even just managers having to have a difficult conversation with an employee. Anybody that needs to practice communication skills can utilize SPs. We also have some outside clients. So we work with the Children's Hospital of Philadelphia. We work with the veterinary school, social workers, etc. And we've been working in person. And then, of course, we had to pivot to some online. So pretty much the way we're speaking now over Zoom, let's say, we would run our sessions. So we were able to continue to work and employ our SPs during the pandemic. And we've since returned to in-person, but we still do have some things that happen online, which is wonderful. So the reason we're here today is because we do have a small but growing number of trans and non-binary SPs that have been working in our program. We've been able to recruit some folks from word of mouth, and we're always looking to recruit. Some are actors, some are not, and that's fine. We train people from all walks of life.
Speaking of which, I think we have a flyer here because you're currently hiring.
We are hiring. We can share that. There you go. Feel free to access that. That links you right to our website, and you'll see an application there to fill out. And really, our group of SPs, this priority population, they may portray cases based on gender identity, as well as other parts of education and assessment that don't center around that. You might come in with knee pain. You might be a person who has a dog you're bringing into the vet. So we are including them in all of our programs. And this aligns with our medical school's values of commitment to diversity and inclusion and access and health equity, really just preparing our providers to be the best for all patients from all walks of life. So we really are excited about being a part of today's panel, and we do encourage you to reach out if you'd like more information about what we do and if you'd like to be a part of us.
Yeah, thank you, Janice. Well, speaking of our panel, let's bring out our panel. So thank you for joining us, Janice.
Welcome.
And we'll see you in a little bit, or see you in the audience in a little bit.
Okay, sounds good. Thanks, everyone.
All right, bye. All right, so I'm going to bring out our SPs who are joining us today from the Perelman School of Medicine's SP program. So I'm going to let them introduce themselves. I'm going to bring them all out at once. So please welcome Corey, Lex, and Jack. So, hi everyone. So, yes, with the first question, I'm just going to let you all introduce yourselves. And actually, I don't know if I ever introduced myself. Hi everyone, I'm Vincent. I'm the coordinator for the Mark David LGBTQ Center, and I will be the moderator for this panel today. And let's just go like from left to right, and then down left to right. So Corey, then Jack, then Lex.
Okay, cool. Hi, everyone. I'm Corey. I use they or he pronouns. I have been working with the SP program now for about 3.5 years. I was hired when they were specifically looking for trans and non-binary SPs a while back, and I'm also a trained actor, so it just seemed to lean very well into many things that I was good at and already liked doing. And I have also been a program assistant for Penn, and I've worked in a lot of the different programs, both in cases where I am specifically that are gender specific or that are specific to my trans experience, and in cases that are outside of my trans experience. But my perspective as a trans patient is still valuable and useful, even in cases that are not centering it.
Great, thank you.
Great. Hi, I'm Jack. My pronouns are they, them. I've been a standardized patient for maybe about 4 years. Yeah, most of the cases that I perform are not specific to my gender, but there are some that I have performed that are specific to my gender. And hopefully in the future, there'll be more.
Thank you.
Hi, my name is Lex. I have been a standardized patient for like 3 months now, so I am pretty new to things. And yeah, I've done a variety of encounters, one of which did have to do with my non-binary identity that Corey was actually the trainer on, and that was awesome. But yeah, I'm an actor in the city, and I actually found out about the SP program through Philadelphia Asian Performing Artists. So yeah, I've been like, I found it really rewarding work so far, and I appreciate being able to bring the full intersections of my identity to each case. Yeah.
Oh, great. Well, thank you all for sharing a little bit about yourselves. So I'm just going to jump right into our first question. What is healthcare discrimination, and how does it impact patients with marginalized identities, LGBTQ patients in particular? And feel free to just jump in, whoever wants to go first.
Yeah, I think there's so many things to talk about when we're talking about healthcare discrimination, especially with LGBTQ patients. And just firstly, that like LGBT people are at greater risk for a lot of like serious medical problems that then they are also denied access to and have less access to, and even if we get that access, are subject to mistreatment, even if you get there. And I also feel like it is incredibly important to acknowledge in the beginning of this conversation that these are intersectional issues, and the different ways that your racial, ethnic, socioeconomic background, have to do with your experience as an LGBT person showing up in a medical space. Like each person has like a different connection, historical connection to that, and then present day effect. So like, yeah, I feel like that was a lot. But yeah, just starting off on the idea of being at greater risk for things, having barriers to proper care and treatment, making it less likely to even seek out help, and in some cases being denied help altogether.
Thank you. Does anybody else want to add to that?
I could jump on real quick. Just something that you said at the end there that I wanted to comment on too is the lack of even wanting to seek out care at a certain point, because in my experience I can say I am a low-income person. I'm on Medicaid currently, and a lot of the community health clinics, which are where I can access most of my care, do have all the signage in the world about how LGBT friendly they are and whatnot, and I have almost never gone to any doctor appointment that I have ever been to in my life and not been misgendered, dead named, you name it. That has almost never happened, and that is at these places that are very outwardly supportive and accepting of people like myself. So yeah, it's exhausting. It's exhausting.
Thank you, Corey.
Yeah, I also wanted to touch on the section in which you spoke about with intersectionality as well. Being a Black genderqueer person specifically, we already have a long lineage of discrimination, specifically around just that intersection. So it's layered. Yeah, there's a long lineage of just fears around seeking medical contention just based on that. So yeah, I just wanted to add that part.
Yeah. Thank you all. So our next question is, how does standardized patient programs help combat healthcare discrimination?
Well, I feel like having a general practice of showcasing different kinds of people is an auto combat. Just showcasing diversity in real time is an automatic combat to discrimination. Plainly because folks that are practicing in healthcare get an opportunity to get feedback, which isn't really a thing if you're a real patient. Usually, speaking from personal experience, if I don't like something, I just don't go back, I just don't say anything and I just don't return. But when someone has the opportunity to receive feedback on it, they can make the correction before they actually get to a real live patient.
Great, thank you.
I think a lot about who's in the room when decisions about what's best for patients are being made. And on an institutional level, the people who are in the room are pretty largely cisgender, heterosexual, white, financially stable, mostly men. And that's just the reality of what the system is thus far. And so if you have a room full of people who have one specific experience and don't necessarily have the experience with the different intersectional identities that we're talking about, and these are the people who are making the decisions about what is best practice, how we treat patients, all that stuff, the conclusions that you're going to come to from those conversations are going to be pretty lacking, and pretty non-inclusive, just by nature of people not necessarily knowing even when they have unconscious bias and whatnot. So what I really love about being an SP and about having these interactions, this is largely who we're working with as the next generation of healthcare providers. And these providers are getting firsthand experience working with people of different identities who they may not have had the chance to interact with prior to that, and who, if they had never worked with an SP, could go into practice having never had the opportunity to work with and never have kind of the skills around how to interact with people who are different than them in that way. So not only do we have the opportunity to be in the room in that way, but also when we give our feedback, we're giving our feedback from a real place of like, this is how it felt for me as a trans person, as a, you know, whoever we are. And so that feedback that we're going to give is going to be valuable not only in that moment for that provider, but also in changing the culture of medicine as we go forward. And I can say that with that in mind too, like if we're working with someone who feels nervous, or it feels, you know, some sort of reticence or resistance to interacting with us, then one, that's a good opportunity for them to check some unconscious bias that they may have, and they're getting that experience before they're working with someone who is not empowered to take whatever time and space they need in that moment, or give whatever feedback they need to give in that moment. But also they're then getting the opportunity to practice and to mess up if that's what's going to happen, but to mess up in a way that is productive, because like it is when we are uncomfortable and we take that uncomfortability to unpack and to change, that's when we grow, both as individuals and as like a society. So it's almost like, I mean, I obviously in a perfect world, I like never have to worry about like a healthcare provider, like someone I'm working with as an SP saying something that like really throws me off, or like hurts my feelings in a personal way. That will happen. But the empowerment that I feel to then be like, hey, when you said that thing about like, I'm biologically a woman or whatever, like that really hurt my feelings. And here's why. In the future, what can, how can we workshop this in a way that you still get the information that you need from a medical perspective, from like the clinical perspective, and I'm getting the respect I deserve as a patient who's in your room, who's trusting you with my care.
Yeah.
And I also think that entire idea, like the entire idea of having an SP program in the first place, is challenging the relationship that has been created for so many years between medical providers and patients, especially people of color, like BIPOC people and queer people. I mean, the invention of racial categories, the invention of queer identities have been from this place of needing to fix you, needing to alter who we are, and creating an SP program is really like the idea in itself combats this idea that patients are just bodies and like dummies and like things to take advantage of for the greater good of medical advancement. For so long, like the patient was ignored for like this like esoteric like projection of like, oh, advancement, like we'll get knowledge from this, instead of like empathy. And like the SP program is centering around empathy and around the people who we have been meant to heal and for so long have been treating just as guinea pigs. So yeah, I think there's so much that we're all getting at, of just like every time that we're in the room, there is like this need for like a cultural competency and like being able to give feedback and actually have that be valued within this system that like didn't value it for so long. It's big. Yeah.
Thank you.
Many of our programs even are recorded, which I think is so wonderful, especially when it's like a testing environment. So the whole thing is recorded and it's uploaded in a place where the learner can then access it later. So a lot of times, like they'll get the feedback verbally from us and they may like not necessarily be resistant to it, but like not remember the moment, or maybe they are unaware of like the impact that it may have had, but then they rewatch it and they can see the change happen, and they can they can reference back how it felt to receive that feedback and to see, you know, from that perspective, that outside perspective. That is just inherently going to have an effect on people no matter what, you know. And thankfully with the right people in the room, and by the right people I just mean people who are, you know, empowered to give these positions or these opinions, that impact will be a positive impact on medicine overall.
Yeah, thank you. Can you tell us about a time when you noticed the impact of your work as an SP, that had the impact it had on medical professionals or patients?
I can tell the story that I always tell in the admissions program because it's like my favorite thing that's ever happened while I was SPing. And it was a small group interaction, which is usually like 6 to 8 learners. These are first year medical students. Largely, they do small groups at all ages, but this was a small group for first year medical students. I was the SP in the room. Usually about 2 or 3 of the people in the room will interact with me one-on-one in front of their peers, and will all receive feedback and a different aspect of the patient interaction. When I was giving feedback for, I think, the first or second learner that I had interacted with that day, one of the feedback points that I gave was that when they asked me how I would like to be referred to after introducing themselves with their name and pronouns, it made me feel really safe, and like it made me feel, you know, like that I, you know, I had a seat at the table, that like that me having being someone who wants to, you know, talk about my pronouns was not something that was like completely what's the word, over this person's head kind of thing. And afterward they said, you know, that's really helpful to hear. And I actually very recently have discovered about myself that I actually also use they them pronouns, and like that I am also identifying as non-binary, and like I haven't told anybody yet at school, and I've been really afraid to, but like getting that feedback and like hearing that like you felt brave like makes me feel really brave, and like now I really would like to like share that with my class, and I would like for them to know that about me. And I was just like I'm in character, but I'm emotional. It was very like, it was just one of those moments where I was like, wow, like I remember being in school and not wanting to tell anybody about my gender because I was just 100% sure that nobody would respect or acknowledge it, and I just couldn't do it. And that was in theater school. So like I can imagine how much harder and how much scarier that would be in like medical school, where you know, and so that student being brave in that way with me really just, I think it impacted everybody in the room.
Great, thank you, Corey.
Corey, I actually had a very similar but experience. Let me say that. Yeah, but it was mostly about, it was a first year medical class. And they asked me about the pronouns. And then when I was giving feedback, the student actually wanted to unpack what that meant for me. And I got the opportunity to explain to them about my like lack of subscription to binaries, and how it's like a spiritual response as well as a political response, and how for me gender has always been a kind of violence. And when I explained it to him in that way, he then recognized, that it was safe for him to use his pronouns in front of the class. And like towards the end of the encounter, or the feedback session, I should say, yeah, he then came out to the class at the same time, and I was like, again, tear slowly dripping down my face. Yeah, but yeah, that was, yeah. Mhm.
Wow. Those stories are amazing. I I have never inspired a coming out in the SP program yet. It's only been 3 months. Um, but yeah, I've had some really impactful experiences working with this one specific case, which works with first year medical students. And it's more a practice in empathy than like any of the medical content stuff. So this person is non-binary, and they talk about their experience being discriminated against like in the medical field, and that's kind of like the setup of the encounter. And it's just yeah, and it was in that kind of group setting where it's so like 10 people in the room, and being able to see how each encounter progressed after I gave that feedback to each person was really inspiring to me. And that like the first person might not originally ask preferred name or pronouns or anything like that, but then the next person did. And then I noticed that the proctor in the room, who is there just to keep time and to supervise over everything and have more of like that medical viewpoint. The proctor in the room was continuing to use she, her pronouns during the conversation afterwards. And one of the learners, first year medical students in the room, corrected her. And I don't know, to me, it was kind of, I mean, obviously I felt advocated for, and and it was also a good example of how we, everybody always needs to be learning, and that, you know, to have like this first year student, like be able to, like build in that sensitivity and like have it like in their bones, like just like starting out in the medical field, like it gives me a lot of hope for where they'll go in the future. And that people who have been in the medical field for a long time, who have been like in a certain habit and in a certain way of even like viewing bodies for so long, can now learn and like learn through teaching and be able to be better role models as well. Yeah.
Great, thank you. All right. Have you personally experienced medical discrimination, and how did that experience make you feel, and what did you do in that situation?
That's such an interesting question, because literally every time I go to seek medical attention, I'm discriminated against. There is some kind of interaction that leaves me feeling like I was not seen, dehumanized, etc. So I'm just trying to think of like a specific scenario, or like a one that's, you know, yeah, I do remember one particular moment that sits with me often, outside of being consistently misgendered. There was like a history taking that doctor was asking, and it was like of like sexual nature, about parts and things like that. And yeah, they were asking me about my like sexual history, and they asked me, or so you know how they ask you the question like, how many sexual partners have you had, or how many sexual partners have you had, in the past 6 months? And I remember the doctor just being like, just give me a ballpark figure. And I was just like, oh, um, yeah, like there's this assumption around queer people being promiscuous or having like multiple partners or having, yeah, uh, yeah, that always stands out to me every time I think about discrimination in the medical field. That moment. I am one of those people that leave and don't come back. So in that moment, I just was like, okay, I'm gonna get up and go now. Which in turn is why we're here today, to talk about how like this needs to be addressed, and yeah, yeah.
Thank you, Jack.
Yeah. Thank you for sharing that, Jack. I also find this question to be difficult in that, like, okay, my story has like a little intro and conclusion, I think. But like when I was talking about like healthcare discrimination in general in the first place, and how much more likely queer people or LGBT people are to experiencing like certain things. I have a little bit of notes that LGBT people are at a greater risk of things like suicide attempts, mood disorders, substance abuse. Sorry, trigger warning. I will be talking about mental health issues and suicidal ideation. But essentially, like, as a queer BIPOC person with a history of mental health issues, it's hard for me to pinpoint exactly with the experience I'm about to share, like where the discrimination was, why I was treated that way. And honestly, like in the moment, it is irrelevant to the experience. But when I was 18, I was hospitalized for a major depressive episode, and I was far away at college, like across the country. And my phone was dead at the time. I went to a teacher essentially about my crisis, and I was like, she called the police, and I was taken to the general hospital. And I noticed that just with my history being taken, especially like, talking about like my sexual history, etc., that like, and combined with my mental health issues, just the treatment that I was receiving and the empathy that I was receiving was starting to shift away. And I also had some substance abuse problems at the time. So I was hospitalized within the general hospital for 3 days on an IV before going into the behavioral health facility. So those first 3 days, like within the general hospital, was when I experienced the most discrimination. Essentially, again, I was across the country. I was told multiple times that like my phone was dead. I was told that like I would be able to contact my mom. I was just asking everyone like if I could call my mom. She doesn't know where I am. And like I just saw people look through me just not take me seriously. And like, there was one nurse in particular who was like, I don't know, she was just putting my IV in and like sticking me a bunch and just not apologizing. There was a lot of that. I told her that I was vegan and she was like, we don't do that. And like literally like was giving me like meals with meat in them that I wasn't eating. And like when I did eventually get a different nurse, because like the shifts changed, she was like, yeah, no, that's we have vegetarian meals, like we're a hospital, like of course we like understand dietary restrictions. Like she really just ignored me. And when I got upset, I'm crying for my mom and I was just sedated. It was, I mean, I'm 23 now, and it's one of the most traumatizing experiences I've ever had. You know, and in some cases, discrimination is obvious. You say, oh, like I'm trans. I wasn't even out as non-binary at the time. I can't even imagine if I had been in a place to self-advocate to be gendered correctly. Like I can't even factor that into my brain. Like, but you know, in some cases it's obvious, and in others, like when it's happening to you, especially when you're living under this complex intersection of identities, it's hard to know what exactly is warranting your mistreatment. And like many people who experience medical discrimination don't have the privilege of reflecting back on these experiences because they don't come out of them alive. So yeah, that's my story. Thank you for listening to it.
Yeah, thank you for sharing. I'm sorry that that happened to you. That sounds really unpleasant and frustrating and scary and a lot of things. But yeah, thank you for sharing that.
I had to take a second, Lex. I imagine that was really hard to share, and it was hard to even hear, and you didn't deserve that. You deserved so much better, and I'm just really sorry that you went through that. And I hope that people won't have to continue to go through this, because it really is just unacceptable isn't even the word. It's violent. It's incredibly violent, and I'm really sorry. As for myself, as it relates to this question, I will also content warn what I'm about to share as relating to non-consensual surgical what's the word? Non-consensual surgical revision of genitals. I'm not sure if that's quite clear enough, but I hope that that's so I have given birth. I have a 3.5-year-old named Phoenix, who I love a lot. She's the best. But when I was pregnant, I mean, in general, throughout my pregnancy, I experienced some of the most constant medical discrimination that I experienced around my trans identity thus far in my life. Prior to that, most of my doctors and care team knew that I was non-binary and wasn't great about it, but generally speaking, respected that was the case and just sort of, kept it pushing. When I was pregnant, it seemed like everybody had just kind of decided that only women could be pregnant, and therefore anything I had said before about my identity as a person who is not a woman was completely out the door, 100%. So every interaction that I went into was very much centered around the impression that they had of me as a pregnant butch woman, and that was frustrating at every corner. I'm sure you can imagine. But the thing that really stuck with me, the thing that really like I did that. So after I'd given birth, my doctor informed me that they're after the fact. So my doctor was, doing stuff. I had a lot of medical issues during my pregnancy and after giving birth. So there was a lot of like moving parts. I was like on an IV drip for 24 hours after giving birth of magnesium because I had severe preeclampsia, all this stuff. So like I had a catheter in, and like I wasn't allowed to wear underwear even, like, because there was just so much blood. Like I was hemorrhaging really bad. And at one point, my doctor was like recounting to me like what medical maneuvers they had done, and she was like going through all of the like necessary things they did to like stop the bleeding, and like the things that they did to like assist in the preeclampsia, whatever. And then she was like, oh, and also like since you had a first degree tear, and like usually they heal on their own, but like, since you're like young and like you have a partner who I'm assuming you like have like regular sexual relations with, like I just went ahead and like stitched that up for you, so that'll actually heal a lot better for you, and you'll be able to, you know what I mean, like go back to having a similar like quality of sex that you had prior to giving birth. And my stomach just like dropped, because I when she had said to me that there was a tear originally and that it was a first degree tear, I didn't feel the need to point out to her that I would not want that repaired medically, because in the vast majority of cases, they will not repair a first degree tear. That's a really minor tear. Most people who give birth that through that body part will have some tear degree, and this is the lowest degree. So like, as far as any knowledge that I had about medical necessity around that, I had no concept that that would be something that I would even need to like say explicitly. And then when she said that to me, I was mortified, because I couldn't believe it. Actually, I couldn't believe that had happened. And afterward, I not only was not able to return to my normal pre-pregnancy intercourse, I was not able to do anything related to my vagina, including like wearing a tampon, or I was actually using menstrual cups at the time, but I absolutely could not do that. I couldn't do anything for several months after giving birth. And when I was having the most bleeding that I had ever had in my life, and I couldn't even like take care of those things the way that I normally would, because anytime I even interacted with that body part, there was so much pain and so much tightness that it was like incredibly uncomfortable. And it lasted for a long time. It took a lot of intervention to be able to just have it be normal again. It's for me, like at the time, I was like trying to like give her the benefit of the doubt, like give the doctor the benefit of the doubt, and like maybe X, Y, and Z. And then I was talking to other people who are in a group that is specifically for trans and non-binary people who have given birth, and I found out that this is like really not uncommon at all, and that it had happened to many other folks, and very specifically, and like with a really similar verbiage said. And at that point, I realized that it was probably more than just the doctor thinking that she was helping me out in a whatever way she was saying, and maybe more like intentional, even if it was unconscious. Yeah. that was probably the most impacted that I've been from that kind of discrimination.
Wow, thank you for sharing, Corey. That actually, like, you bring up 2 points that I hear a lot, especially when it comes to like childbirth and pregnancy. One of which is like transmasculine or non-binary folks who have mentioned the kind of like pregnancy being seen as a woman's thing. Is something I see a lot in the trans community. And the other is that kind of like for the sake of your partner piece. Like the fact that your doctor said that they added that stitch or they repaired that tear because you had a partner, like that they put your partner before you. I hear that a lot in medical discrimination cases, especially around folks who have vaginas or uteruses, where it's like my partner was considered, or I wasn't allowed to have this procedure without my partner's permission. I needed to get my partner's impact. So also, Jack earlier mentioned kind of the intersections of race when it comes to discrimination, and like a lot of the like viewing people of different races or different genders of experiencing pain differently, or reporting pain, over reporting or under reporting pain, and like there's so much like subconscious bias that like exists in medical providers, and that can harm people even if they didn't mean to, even if they thought they were doing the right thing. Like you said, with this doctor may have thought that they were helping you out. They seemed to speak in a way that seemed like they were doing you a favor, but in reality, they did something you didn't want them to do because they didn't consult you or talk to you about it.
And this is with my experience too. Like, I want to say, like, as a white person, and like Black gestational parents in particular have some of the like highest rates of like parent mortality as it relates to childbirth, and highest rates of like serious medical malpractice as it relates to childbirth. And it's well documented and well understood, and it's still happening to this day to a very large extent. And it's like, on one hand, I'm like, we need to talk about it more, and I'm also like, well, we've been talking about it for a long time, and like it's still happening. Like they're like, I don't know exactly what needs to happen, but the fact that every single Black person I know who has the ability to get pregnant has a very serious, real, and valid fear about whether or not they're going to survive that is just unacceptable on any level. It's not fair. It's just not fair.
Yeah. The mortality rates for Black gestational parents is higher, like it's very high in this country particularly. Like, yeah. I also want to mention, because I don't believe we have any intersex representation on this panel, that another very common medical discrimination thing that happens is genital correction. And I use correction in air quotes because it is an unnecessary cosmetic procedure where they basically will make an infant's genitals match the expectations of what a penis or a vagina looks like. And it's completely cosmetic, done to someone with functioning genitals at an age before they can consent or even say what they want or how they identify as far as gender goes. And that's a big push in the intersex community to stop that practice, because sometimes it's even done without the parents' consent, and just the doctor just does it and then tells them after the fact, like Corey mentioned earlier with their experience. So thank you all. And again, if anybody needs to take a break, you feel free to turn off your camera for a moment and take that moment. And I'm going to move on to the next question. And this is actually our last question. If anybody has questions in the audience and would like to put it in our comment section, we do have the ability to kind of pull up our little comments here. It's a little note to Lex here from the comments. So if you would like to ask follow-up questions or have any additional questions that you'd like to ask, feel free to drop them in the comments. I just ask that you refrain from asking super personal or invasive questions. And we will bring those up after this, which is our last prepared question, and that is, what advice would you give to patients experiencing discrimination to help them advocate for themselves?
I think something empowering to remember is that you know your body. You know your body better than anyone. And, there's no situation, there's no excuse, there's no, like, if you have a feeling, and reading about medical discrimination in a lot of these like scenarios, there's so much gaslighting that happens. And there's so much like not trusting your own instincts about your body, and then being failed because of what so somebody else decided to project onto you versus your actual needs. But that you know your body and that it is yours, and that you can be a self-advocate for the type of treatment that you need, even though you shouldn't have to be. And that, you're not alone. And I'm sorry. And these aren't really things that have material, weight to them. But I think an important first step in making any kind of change or transformation is to be able to validate and sit with yourself and admit when you have had certain experiences and be able to validate them. Yeah. And that there are avenues in which we can like officially go through to report these things. And there are people and there are organizations that do care about you.
Thank you, Lex.
I would say, like, echoing something Lex said, like, trust your gut. That's like the main thing. If you feel like something's not right, or like you're feeling like hurt or impacted adversely by an interaction that you're having with a healthcare provider, you don't I think that like the way that like we build up our society, like the idea of like innocent until proven guilty, we're like, oh, but like they didn't like necessarily like say this like outwardly racist or transphobic thing, so like whatever. But like the feeling that you have as a person with that experience in relation to how you're being treated is more relevant and more accurate and valid to describe whether or not you're experiencing discrimination than any like specific verbiage or any like whatever. Like I said earlier, like some of the clinics that I go to have all of the signage in the world that they are the most LGBT friendly places, and that has not necessarily always been my experience. So trust your gut, I think, is most important. Another what's the word, tactical, I think, or like tangible, I don't know, whatever, word that begins with T, that's not trans, thing that might be helpful is like talking to other people with a similar experience to you, both before and after. So like for me, like being a part of groups that are specifically like, I'm in a group that's specifically for like trans gestational parents. I'm in a group that's specifically for trans people who breast or chest feed their children. I'm in a group for people like who've gone through the process of HRT, through the process of top surgery, through the process of bottom surgery, whatever, already, or folks who are pursuing these things, folks who are interested in these things, whatever, all coming together to have conversations, oftentimes just like you know, what doctor did you go to? Or I had a good experience. So like at this doctor, at this place. So like if you are someone who shares this identity to me, like you may also have a positive experience at this kind of place. And there's that part, like the before part, and then the after part of like if something does happen and maybe you don't necessarily feel empowered in the moment to speak on it, and you're gaslighting yourself on some level, or people are gaslighting you, talk to other people who are like you, let them know what happened, and get that validation from people who, you know what I mean, like who can actually speak to what your experience in the room may have been. And sort of like in line with that, like having a trusted friend that can like accompany you to appointments, particularly with new providers, can be really, really helpful. I know I've had times where I've just like had a friend along that I was like, I've historically been really bad at correcting people when they use the wrong pronoun for myself. And so like when I go to a first provider, sometimes it's really helpful for me to have a friend there who is one of those friends who, you know, like you oftentimes like a cis person who doesn't have necessarily like their own struggles with being misgendered, so they're not like personally impacted in the same way, and like have no no f's to give, for lack of a better word, about like this doctor or whatever. They are like completely focused on making sure that me as their friend is respected and validated, and is not afraid to like say, actually Corey uses these pronouns, that can be really helpful. And also just like in those moments where you're like, oh, I don't like, am I overreacting to this? Did I misread this? Whatever, that those, having another person there can sometimes be all the reinforcement that you need to kind of unpack or to understand all the aspects of what you experienced from someone else who was like in the room.
Yeah, I feel like it's also harder to gaslight you when there's another person in the room, because it's really hard to make you doubt your memory when you have a second person there to remind you of what happened. I also want to add, I've had several friends, and I've actually heard this advice a lot from Black women specifically. A lot of them have told me over the years the best way to advocate for yourself medically is to, when a doctor refuses to take you seriously or to explore care options that you think are beneficial or necessary, is to ask them to note it in your chart, and basically say that the patient like requested this or requested that you look at this and you refused. Because the doctor now, if you ask them to put that in your file, they now have to write that. And then later, if down the road that actually is what's going on, that person could be facing a malpractice lawsuit and lose their medical license. So they're probably going to take that a little bit more seriously now, and they're not going to want to write, the patient asked about this thing and I refuse to take them seriously or look at that thing. So they may actually do whatever test or even explain, I know it's not that because of this reason, and give you more information. So it's a great tool for advocating for yourself, to force a doctor to take you seriously, and to do things by the book, because you're basically asking them to document what is happening in writing.
And you can also you as a patient are always privy to any of your medical information or forms. So if you do request that be put in your chart, what I would also recommend is to ask for a printed out copy of that where it is in your medical information, so that you can have that for your file. That way, regardless of what happens next, like if they were to take it out or whatever the case may be, that you have like a copy that you can, you know what I mean, that you have on hand and you can add to your paper trail if, God forbid, you have to escalate the situation, which unfortunately happens,
Yeah. Well, that is all the time we have for today. So I just want to ask if any of the panelists would like to add any last minute thoughts or anything that they didn't get a chance to talk about.
No, just thank you for having us, Vincent. And I'm really glad that we're able to have this conversation. It's healing.
Thank you for being here. Thank you for sharing your experiences. Thank you again to the Perelman School of Medicine Standardized Patient Program for providing our panelists for today. Again, They are currently hiring, especially BIPOC folks who, so Black and Indigenous people of color, because I don't think we actually ever said what that acronym means. So if you are interested, especially if you have an acting background, this could be a great fit for a job. So check that out. Thank you again to our panelists and to Perelman School of Medicine. And we will see you next month on December 1st for our World AIDS Day panel, which will be a fun version of Drag Me to Class, hosted by two drag queens who are a scientist and a healthcare worker who are going to talk about HIV and AIDS and the history of the epidemic and new medical things that are coming out and exciting advancements that have been made in the past few years. So we will see you on December 1st for our next discussion. And thank you all for being here. Have a great rest of your day. Bye.